Hello everyone, welcome. Fitting the theme of Mental Health Month for May, I'm thrilled to introduce today's Wellness Wednesday, using exercise as a tool to boost mental well-being. I'm Deanna, the program assistant for the BC Brain Wellness Program, and I'll be your MC for today's event. Before we dive in, I would like to take a moment to acknowledge that the BC Brain Wellness Program at the Javad Mofajian Center for Brain Health resides on the traditional, ancestral, and unceded territories of the Musqueam people. As a settler here myself, it's crucial to recognize the profound relationships we have with the Indigenous peoples and the land, and to continuously honor and nurture these connections. We're privileged to be able to offer programs like the Brain Wellness Program on Musqueam land. As we gather from various locations today, I urge each and every one of us to pause and reflect on the history of the land we inhabit. You can explore more about the land's history through the resource provided in the chat. Let's take this moment to deepen our understanding and respect for the Indigenous communities and the territories we occupy. Moving along, we are thrilled to have our fantastic guest with us, Cassandra Kelcatrice, a graduate of Bachelor of Arts in Kinesiology from Western Ontario and personal trainer with the Canadian Society of Exercise. After completing her degree, she worked as an exercise professional and clinical work. She moved to Vancouver to pursue a master's degree in kinesiology at UBC, where she currently directs research focused on the design, implementation, and evaluation of exercise interventions as a treatment for depression. So for today's event, Cassandra will be highlighting the connection between mental health and physical health, as both encompass emotions, thoughts, and feelings, being able to manage life's challenges and the feeling of connectedness. Alongside learning about the mental health benefits of exercise, Cassandra will showcase some strategies you can implement in your daily lives to improve your overall well-being. As a reminder, each individual's body and background are unique. Some things that work for some people may not work for you, and that's okay. So we encourage you to adopt practices that resonate most with your personal experience. I would like to also take a moment to thank our program donors for supporting the BC Brain Wellness Program. Because of your generosity, we are able to provide these amazing educational events in our online classes, creating accessibility to anyone and everyone. As an entirely donor-funded program, we rely on your generosity to ensure the continuation and development of our program. So thank you for your ongoing support. Without further ado, I will pass on the Zoom mic to our guest speaker. The floor is all yours, Cassandra. Welcome.
Well, hi everyone and welcome. Thank you for such a lovely introduction, Diana. As she mentioned, my name is Cassandra, and today's Wellness Wednesday seminar will be discussing how exercise and physical activity can be a really powerful tool to support our mental health and our overall well-being. And in line with the Canadian Mental Health Association's Mental Health Awareness Week, which is next week from May 6th to 12th, I'll be discussing how the theme of this year's Mental Health Awareness Week is a call to be kind. And from their website, they share that we all have this capacity to be compassionate, and we know that doing so can make an enormous difference in our lives and in the lives of those around us. And so the focus is centered on the healing power of connection and compassion. And Diana mentioned that exercise can look different for everyone. And so today's topic, centered on mental health and exercise, can be even more powerful if we take a compassionate lens. And so everyone has mental health and everyone experiences challenges regarding their mental health and well-being throughout their lifetime. Connecting compassion to this and exercise, I want us to enter this seminar today with a compassionate lens and being open and compassionate to the ways in which exercise can look and feel different for every body, and also different for us within our bodies every day. So while we're thinking about exercise, maybe we think about being compassionate to ourselves by choosing exercises that we enjoy, listening to our energy levels, being kind to ourselves if exercise looks different now than what it once did, and accepting that every little bit of movement counts. Now, before I start off today, I will just give you a little bit of a background about myself. And so, how my career in using exercise as an exercise professional has led me into the field of mental health awareness as well. I'm originally from London, Ontario. I grew up in movement. So I grew up as a competitive dancer. I started dancing at the age of 3 and stopped around the age of 23. So I have about 20 years of movement under my belt, which was really a natural progression into studying kinesiology at the University of Western Ontario for my undergraduate degree, and also a natural flow into working as an exercise professional. And so I worked as a personal trainer and nutritionist for about 2.5 years during the pandemic. And during this time, working in a healthcare center, I think we can all reflect back to what those years really looked like. And if you were in Ontario at the time, we had some more closures than you did here in BC. But our clinic opened and closed several times. And so I have this background of being a mover, and I knew personally how much exercise was helpful for my own mental health. But in clinical practice, I was able to see repeatedly as the clinic opened and closed how much my clients and my patients needed their regular physical activity to maintain their mental health, and how much they were impacted when they weren't able to be physically active in their normal capacity. And so this led me to where I am now, completing a master's degree in kinesiology, with my research focusing on how to develop exercise programs or prescriptions for individuals with depression, and really broadly how to use exercise to feel better and boost our own mental health. And so today I will start with a background on what mental health and mental illness is, how exercise can impact our mental health, and then following strategies for how to incorporate exercise and physical activity for our own mental health and well-being. And then we'll follow up with some questions. So to begin here, why is mental health important? And the Canadian Mental Health Association states that everyone has mental health, and so everyone will experience challenges regarding their mental health or well-being within their lifetime, although this doesn't mean that everyone will experience a personal mental illness. However, mental illness impacts all of us, whether it's personally or through a family member, friend, or peer. And even further, some statistics: in every given year, 1 in 5 people in Canada will personally experience a mental health problem or illness. And by the age of 40, about 50% of us will have had or will have a mental illness. And so this is a really prevalent topic of concern and conversation, and really emphasizes why it's important to make sure that we have space in our busy schedules, not only during Mental Health Awareness Week, but every day, to support our own mental health and well-being. Mental health and illness are often used interchangeably, although they're not the same thing. And so what is mental health? Mental health is a concept similar to physical health, in which it refers to a state of well-being. Although mental health includes our emotions, feelings of connection to others, our thoughts and feelings, and being able to manage life's highs and lows. And as I mentioned, the presence or absence of a mental illness isn't a predictor of mental health. So someone with a mental illness could have excellent mental health, or someone who does not have a mental illness could have poor mental health. And so further, according to the World Health Organization, mental health is defined as a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her own community. So why is this important? Well, our mental health is fundamental to our collective and individual ability to think express and feel emotions, interact with others, earn a living, and enjoy life. And so, again, as I'm repeating myself over and over again, mental health is really important, and focusing on the promotion, protection, and restoration of our mental health can be regarded as a vital concern of individuals, communities, and societies throughout Canada and the world. Now, I mentioned that an individual with a mental illness can experience positive mental health or a good state of mental health, as well as someone without a mental illness can experience poor states of mental health. And we can think of mental health of being on this continuum or a sliding scale. So, on one side is high levels of mental health, or what we could call flourishing. And on the other side of this sliding scale is poor mental health, or a state of languishing. And it's important to remember that it's normal for all individuals to fluctuate on this sliding scale, whether it's hourly, daily, weekly, or yearly, and that it's normal to be at any state of this scale or at any spot on this scale. Now, when we're on the lower end of this spectrum towards languishing, it can feel like a loss of pleasure, low energy, and fatigue. Although thankfully there are many ways to improve our mental health and overall well-being, coming up on that scale towards flourishing. So today we're going to focus on using exercise to move ourselves towards that higher or more positive end of the mental health spectrum to flourish. So how can exercise enhance mental health? The topic of today. There are many ways in which exercise can help us to feel good. Firstly, exercise has minimal risks if we're selecting a tool to increase our well-being. So with minimal risks, for example, individuals with depression may have a treatment option such as antidepressant medication, which may come along with many physical side effects from taking that medication. While the risks of exercise are known and minimal, and can often be reduced through supervision, proper equipment, and appropriate programming. So this makes it a really great option. As well, exercise can help to improve our overall mood, our energy, and reduce stress. Can help to improve some physical symptoms such as improved sleep quality, as well as some social benefits such as feeling a stronger sense of connectedness to others. And as well, physical health benefits such as reducing the risk of heart disease and diabetes. Now, these are all very broad, but doesn't really answer the question of how. So how does exercise help mental health? And people often tend towards explaining this through endorphins or serotonin, which is released during exercise. However, there are both biological and psychological impacts of how exercise is beneficial. And while there are many different mechanisms and theories which can explain how exercise is helpful, my particular research is focused around the psychological impacts of exercise for mental health. And so this is what I will focus on in this presentation. So examples of psychological benefits are things such as increasing feelings of confidence, self-esteem, and sense of control over mood. Now, psychologically, there are four main functions for how exercise impacts mental health. Firstly, a feel-good function helps us to feel good, as well as using exercise for the prevention, treatment, or management of health. So firstly, the feel-good function. Exercise, it helps us to improve self-esteem and self-confidence. It aids in emotional regulation, helps to improve our sense of self and our sense of body image, helps to improve our physical health status, attention and concentration, family and peer experiences, as well as stress. A recent example that I came across as I was discussing exercise with a new exerciser, I'll call it, someone who hadn't exercised regularly in the past and recently started an exercise routine. They shared with me that having one structured session weekly in the morning helps them to set themselves up for the day and also increase their energy and their sleep throughout the week, and sort of had this cascade of effects by having that one exercise session. They started to think more about the meals that they were selecting and maybe choosing a few more vegetables or healthier options. They started going to bed at a regular time, and actually started to think about other ways that they could incorporate exercise. So it helps us to feel good immediately after exercise, but also often has this cascade effect that translates into the rest of our lifestyle behaviors to help us feel good throughout the entire day or the week. And so the second way that exercise helps improve psychological well-being is through preventing mental illness. And so in populations without a pre-existing mental illness, or individuals without a mental illness, higher levels of physical activity can reduce the risk of developing a mental illness in the future, particularly in depression and cognitive decline. So in general, the less active that a person is, the more likely that they are to report a mental illness. Um, Moving forward with that, the third way that exercise improves our well-being is in those with an existing mental illness, and regular exercise has been seen to benefit many symptoms or diagnoses, which can help reduce symptom severity, such as reducing depressive symptoms, reducing anxiety, and helping to reduce and combat stress. Um, Fourthly, physical illnesses and mental illnesses often co-occur, and so exercise can be used as a management tool for both. So being diagnosed with a physical health condition such as cardiovascular disease, for example, can be very stressful. And for some people, this stress is enough to cause poor states of mental health, or a mental illness such as major depressive disorder, generalized anxiety disorder, or panic disorders. And so exercise can be really beneficial to manage both the physical health symptoms and mental health symptoms. And so the take-home message here, repeating myself a little bit, but exercise is beneficial for both our physical and our mental health. And perhaps this is a good opportunity to tie in that theme that I started off with of compassion and kindness, and to help encourage us to change the narrative on how we think about exercise, and as well changing the way we think about why we should exercise and why we choose the particular types of activities that we choose or that we select. So if we're selecting exercise for mental health purposes, it can be quite simple, actually. It's mostly an activity that you enjoy and doing it regularly. So it doesn't have to be so complicated. It comes right down to that. Now, let's get into how to be more physically active. So shifting the focus to those of you who are listening. We can take a few moments to reflect and maybe share in the chat, if that's available, to send some answers in. So if we think about the ways that we ourselves participate in physical activity, I would love to hear the ways that maybe those of you listening do engage in exercise, if it's currently a priority to you, or any barriers that you currently face towards being physically active. I'll give an example of myself here. So I do currently participate in physical activity, although I'm a grad student, which requires me to work full-time at a desk. I also work part-time outside of school at a desk in front of a computer. So the main barriers that I face is that I'm often quite tired at the end of a work day or a double work day, and that I often have limited time to exercise. And so some of the ways that I get around that is choosing to walk for my method of transportation, or using the public transportation, using the bus, and maybe getting off a few bus stops early to walk home halfway. And I also participate in some group fitness activities because it's structured. I can just go, it's in the morning, I have it in my schedule, and I do it before my workday. I'm just gonna look at the chat here if you see a few examples. Okay, oh, I can see that I had that on the screen there.
You'd like,
Take
Cassandra?
some classes at the BC Wellness Exercise. That's great. Monday to Friday. Another one, BC classes, brain classes online, yoga session, hiking. Amazing. And also some barriers there. Thank you for sharing those. Yeah. Some injuries that can prevent physical activity, some stiffness, soreness. Yeah, those are all completely normal. So let's talk about maybe how much exercise we can think about. PC Brain Wellness classes 5 times a week. Amazing. So let's shift on to thinking about how much exercise we can engage in, and then we'll come back to some of those barriers that you mentioned in the chat. Thank you for mentioning those on how we can incorporate physical activity a little bit more. So I mentioned that exercise is helpful for mental health a few times. How much exercise should we do for our mental health? How many minutes per session? How many steps? People like to focus on steps. Now, sadly, I don't quite have the answer for you. I'll just come back a slide here. So we don't quite know the answer in current research. And a part of this is because the field is so new. And the research that is done on mental health and exercise is really the interventions that are prescribed are quite variable. And so even today, it remains like a rather niche area. However, we do have two main guidelines that can sort of give us a rough estimate. The first one is the CANMAT guidelines for exercise and depression. So in Canada, exercise is recognized as a frontline monotherapy for people with mild to moderate depression. What this means is that depression has previously been treated with either antidepressant medication or psychotherapy or talk therapy. And exercise is proven to be just as effective as a treatment for mild to moderate symptoms in Canada. For moderate to severe symptoms, it's recognized to be an effective adjunct treatment. So maybe in combination with other treatment options such as medication and exercise, or talk therapy and exercise, etc. And what those guidelines look like is an exercise prescription. So if we think about an antibiotic prescription, maybe it lasts 10 days, we have to take the medication 3 times a day. Well, it's quite similar for a prescription for individuals with depression. And the prescription for exercise is 3 times a week for at least 9 weeks, each session lasting 30 minutes or more at a moderate intensity, which could mean you can follow a conversation, you can participate in a conversation without being completely breathless. That's usually that moderate range. Aerobic or strength training, and an additional benefit if it is structured and supervised. So I mentioned my group classes. That's an example of structured and supervised. The BC Wellness classes, structured and supervised. You have it in your schedule. There's someone expecting you to show up, as well as personal training would be another example. Skiing lessons would be another example. A walking group, any of those would count as that structured and supervised piece. Now that's a guideline specifically for those with depression. What about the general population in Canada? Well, there's guidelines for that too, about roughly how much we should engage in exercise. And this is for overall health, so not specifically mental health. And it's focused on the 24 hours. So what does the whole day look like to boost our overall health? Now, the physical activity category here looks like moderate to vigorous activities. So at a brisk pace, maybe up to that breathless pace for 150 minutes or more per week, which is quite similar to the CANMAT guidelines. It goes further to say including some muscle strengthening exercises, as well as aerobic physical activity, as well as covering sleep and sedentary behavior within our whole day. Now there's similar guidelines for adults 65 years and above, which are almost the same, 150 minutes per week of aerobic physical activity, including some strength training and some balance exercises for that age group. That's the main difference between the previous slide and this slide, as well as a slight variation in sleep. Now, Again, I mentioned there isn't a specific dose or amount of exercise that we should engage in. If I come back to this CanMat prescription for exercise and depression, it says 9 weeks here. But if we think back to some of those ways that I mentioned, exercise can help us with our mental health, such as improved sleep quality, improved energy, improved attention levels, and self-esteem. Um, those are often side effects of exercising regularly. So we have an exercise session, and afterwards we feel that increased energy level or increased attention. That night we might sleep a little bit better. And if we exercise 3 times a week, maybe over the course of the week, actually we're feeling better. So to say that we exercise for 9 weeks, starting today, May 1st, until July, and then after that we're good for the rest of our lifetime is probably not accurate. The best way to prevent, treat, and manage our mental health is to participate in exercise or movement long term and regularly. So how do we do this? How do we continue to exercise regularly for the long term? Well, it's difficult. We mentioned some barriers. I think the barriers that we face to engage in exercise or physical activity change throughout our lifetime and based on the chapter of life that we're in. I have an example on the slide here of thinking about a working parent who spends about 8 hours at the office and 1 hour commuting, 2 hours cooking and eating, 3 hours in childcare, doing childcare or domestic tasks, and then 9 hours of sleep if they're lucky. And then maybe there's about 1 hour left for leisure activity, which might be watching TV, it might be going for a walk. But you can see there how time might be a big barrier, or energy. Again, this example might not be relevant to all of us listening today, but I think the barriers that come along with it are relevant or are a shared experience that most of us face of how do we move more. So some common concerns here: time, maybe fear of judgment, motivation, you don't like exercise, maybe some physical barriers such as some injuries or um, changes in physical health condition that prevent us from moving the way that we once did. Fatigue, you don't know where to start, don't have anyone to exercise with. And so again, a lot of shared experiences in these barriers throughout the world, really, in how to engage in more exercise. And I think it's important here to think about how we can be more active in a small capacity. So I mentioned I walk a lot. Sometimes I'll get off the bus stop one stop early to walk for 5 minutes, and that might be the only movement really that I do that day, but it's something. So again, that's a personal example for myself, but how can we think about small shifts and attainable shifts in moving a little bit more? Now I like to think about tools in a toolbox for mental health. And so we have all of these hobbies or tools or activities which we add into our toolbox that we keep inside ourselves of how we can support our mental health. And so tools could be social support, it could be a therapist that we work with, it could be a loved one, a book that we love reading, or a time of day that we love to read. Walking, skiing, knitting, painting, and perhaps exercise. So tools, thinking about exercise, how do we make sure that there aren't so many barriers to grab that tool out of my toolbox to engage in exercise, if this makes sense. So one of the ways in that we can make sure that it's easy to grab that exercise tool from our toolbox is making sure that we set goals that are realistic and that are attainable based on the barriers that maybe we've thought of in those last few slides. And so some principles of some good goal setting, the SMART principle, maybe some of you have heard of this already. It's quite common. So looking at how to set specific, measurable, attainable, realistic, and timely goals to exercise. Keeping in mind being compassionate about what's realistic and attainable for our bodies. So an example could be a specific goal is that I'd like to walk 3 times a week. It's measurable because I'm doing it 3 times a week, but I'm going to add on to that I'd like to walk for 15 minutes 3 times a week. Seems attainable. I typically have a BC wellness class 3 times a week, and I think that I could walk for 15 minutes before it starts, before I turn on the Zoom call. That's 2 exercise examples in a row. I didn't mean to do that. Maybe we can change that too. I have a work commitment that's 15 minutes away, and I can walk to work 3 times a week. Um, it seems realistic. I think that I can fit that in my schedule. And I'm going to try it timely for the month of May. It's Mental Health Awareness Month. Why not just give it a go for 4 weeks at the end of May? I'll see if that was really actually realistic for me, and whether I might have to take that down a notch, or maybe I could walk to work 5 times a week, or maybe I can take the long way to work before adhering to that walk. And so going along with that, helping to set ourselves some action plans or booking it into your schedule. Maybe some of you do this already with those BC wellness classes of when you're going to be active throughout the week, so that you know you have that reliable time to take care of your mind and your body, for mental health and overall well-being. And as well here, I think continuing with that compassionate lens that I've mentioned a few times is that exercise really does look different for everyone. This was really reiterated to me while I was working in a healthcare setting. My patients and clients had a variety of different movement backgrounds. So some of them had never exercised before until their 60s or their 70s. Some of them had grew up as athletes and had really impactful injuries such as concussions or spinal cord injuries, or things that change the way that they could move. And so it's important to be compassionate that maybe the way that you once moved is different than the way that we move now, and that setting these action plans, it's important to be realistic and do things that are maybe in small increments, like 15 minutes 3 times a week. Okay, how does that feel for my body now? Actually, that was really realistic. I think I can probably do a little bit more. So again, just being compassionate with how we think about using exercise for our mental health. Now, I wanted to go into an example of my own research and what exercise can look like in a prescription setting, and maybe can help keep the ball rolling in how you think about exercise for your own mental health. So this is my research project. It's called Mind in Motion. As I mentioned, my research is focused on designing exercise prescriptions for mental health and how to implement those types of programs. And so my lab and I designed a program called Mind in Motion that happens at UBC for students with mild to moderate depressive symptoms. It's a supervised exercise program led by a personal trainer 2 times a week for 6 weeks, which happens on campus. It's really designed to improve student mental health and match students with the best care for them. And a really great element is that participation in the program was free, with a referral of a mental health counselor on campus. And so thinking about what this program involves, it's for 6 weeks, 2 times a week. We had a lot of participants who had never exercised before, participants with depression, but also other physical and mental health conditions. And it was designed really to, like I said, match students with the best care for them. So everyone has a treatment option or a treatment prescription which is best suited to their needs. So for these students, they worked with a counselor and decided that exercise was the best treatment option for them at the time, or the best option in combination with things like medication or talk therapy or group therapy. And that initial session of the 6 weeks was a conversation with the student and the personal trainer, talking about if they had exercised before, if they have any barriers to exercising, what they want to work on, types of movements that they enjoy. And throughout the 6 weeks, it was building a relationship and setting some goals on how they could continue to be active after the 6 weeks in ways which they enjoy to support their own mental health. Um, all of the participants' programs looked a little bit different, which I think is really special to have that sort of individualized care, but more importantly, to have the time and space to select an activity that works for you, that feels good in your body, that you can still continue to improve in, but most importantly, that you enjoy. Um, and so some tips to remember as we're thinking about exercise and mental health is, again, to set realistic goals, and to plan ahead of where, when, and where we can be active throughout the week, doing an activity that you enjoy, and really remembering that small bouts of activity are good for our mental health and that every move counts. So this could be gardening, it could be a 5-minute walk, walking the dog, skiing, BC wellness classes, anything like that. A whole variety of activities, which I'll share a video in a little bit, but that every move counts. And it's important to be compassionate. And so some take-home messages here is that exercise is truly the best medicine for our physical and our mental health, and also that sweat can be the best antidepressant for how we're feeling in our mental health and overall well-being. Now, I wanted to take a moment because I've talked about exercise now for about 35 minutes almost, to give ourselves a little bit of a movement break. So I mentioned that I have been a personal trainer in the past. This doesn't involve you to stand up. Okay, we can stay where we are. We're just going to take a little bit of a movement break, going through some stretches and maybe introducing a new stretch that you've done before several times, or that's completely new to you, and encouraging you to, to maybe do these stretches at home while you're watching TV, or while reading a book, or any of those activities, just to sort of reiterate that every move counts, and even in little bits. So the next few minutes counts as a little bit of extra movement today for you. And so the first one that we will start with is a neck stretch. I'm just going to back up a little bit here. Hopefully you all have space. This now, for the next few minutes, I have about 4 or 5 stretches. This could be a great time to think about some questions and send them into the chat box. I'll go through some questions, play a short video clip, and then we'll get into the question and answer period. So if you want to join me for this next stretch, we'll start by sitting up tall in your chair, couch, or wherever you are in the garden. Sitting up tall, shoulders back and relaxed. And starting with your left ear, drawing it over towards the left shoulder, or a nice stretch, getting into the side of the neck and the shoulder. So this helps to alleviate neck pain, shoulder pain, and prevent some tension, headaches. From here, take a big breath. And then as you exhale, keep the head where it is, tilt the chin down towards the shoulder. And notice if the stretch has changed at all, maybe getting into the front of the neck. Again, taking a big breath and bringing the head back up to the center, and then right ear over to the right shoulder, keeping the shoulders down away from the ears. Slight breath, and then a little head tilt, bringing the chin down towards the shoulder. And little breath, bringing the head back up. The next one that we'll do is a shoulder stretch. So from here, bringing the right arm out towards the side, you'll bring the arm across the body, use the other hand to hug it in close, and then dropping that shoulder down away from your ear. So this gets into the back of the shoulder and into the neck as well. So these first few stretches are really focused on how we can release some tension in the upper body, particularly if you sit a lot during the day, which most of us do. It's important to release some of that tension. Helps to improve our posture, our well-being. Release that arm, stretch it out to the side, and back down. And then we'll do the other side, left arm coming out to the side, cross the body and hug it in. Keep that shoulder down away from the ear. Good. Keep pulling that again. If you have any questions, you can send them through on the chat. Release the hand. 2 more here. This time we'll do a torso twist. So you're sitting up nice and tall. We're twisting the body, just making sure you can see me there. Sitting up tall, we'll take our right hand to the outside of your left knee, left hand to the back corner or back hip, and then just looking over the left shoulder. Good. Slowly coming back to the center, other side. Left hand to right knee and looking over the right shoulder. Keep holding it there. Maybe notice if you have one side that's tighter than the other, or movement restriction on one side versus the other. And then slowly come out of that. The last one we'll do today is a chest opener. So this will look different for everyone. We'll take both of our hands, bring them to your lower back. From here, try and bring your elbows closer together, opening up the chest. If this feels easy for you, squeezing the shoulders back together, you can bring your hands together behind your back, hold the hands, straighten your arms, and then open your chest that way. Maybe bringing your gaze slightly up. See some questions coming through. Amazing. And then you can slowly release that stretch here. I lied, I said last one, but we'll do one more. Just a little bit of a head roll, bringing the head down, around, and up. 2 times in each direction. And other way. Last one, coming back to the center. Good. And then you can shake it out, shake the shoulders out, bringing them up to the ears, down away from the ears. As promised, so that was a little movement break, just a few minutes for a little bit of a stretching. Maybe it encourages us to move a little bit more throughout the day or come back to those stretches. I'll play just a quick little clip here about how every move counts and just providing some examples, and again, reminding that exercise looks different to everyone and that there are so many different ways to engage in physical activity. So I'll just leave my slideshow here. And so although we can't hear the audio, obviously a variety of ways that we can move throughout the day, hula hooping, dancing, gardening, running, swimming, biking, walking. And again, every move counts throughout the day. So I'll wrap up my presentation with that nod to physical activity. I'm sorry that the audio didn't work, but it just gives, again, that sort of take-home message of every move counts. And so I'll pass it back to Diana and we can open up for some questions.
Can you hear me now?
Yes.
Okay, lovely. Okay, great. Yeah, no, I wanted to say thank you so much. That was a beautiful presentation, and I loved how you distinguish between mental health and mental illness, because there is that difference. And yeah, just great techniques like the SMART strategy, which I implement in my life as well. So I'm so glad that you are bringing these things up, and I really hope the audience got to learn a little something today. But now we will answer some questions from the audience for our Q&A portion. And I'll start off with this question. Spinal injuries affect balance. What kind of exercise programs are effective slash when or when you have balance and mobility issues?
Yeah, that's a great question. And I think comes back to that example that movement looks different for every body that we live in. And so if you are experiencing some balance disturbances, maybe from a spinal cord injury, I think that comes back to that piece of having structured and supervised exercise. Where we can maybe participate in exercise programs specifically for spinal cord injuries. That would be a really great opportunity and environment where perhaps you can connect to others who are also experiencing those balance disturbances, but also, more importantly, learn some exercises that you can do in the exercise session while supervised, but also participate at home, which are safe and sort of that match where you're at with movement. Um, as well, if you are experiencing some balance disturbances, there are things that you can still do seated, like we just did, where whether that's stretching, if a movement class isn't accessible to you, then things like a YouTube class. I know that there are some things online which are, seated exercise class. It doesn't just have to be sitting and stretching the neck. It could also be an aerobic class that you do seated, if walking around or jumping around isn't what suits your body best in that day or at this time. So I think there are multiple options. Perhaps if you have any tools or things that help with mobility, then you could use those alongside exercise. So a balance support while walking, for example. I don't know particularly the level of balance that you're at, so it's hard to give specific answers, but I think coming back to that structured piece could really be beneficial, to learn what suits your body best so that you can move for your mental health as well. And if that's not accessible, then maybe looking at some online options that can still support moving more. Yeah.
Amazing, thank you. On to the next question. If you have history of always training physically for sport, but now with medical conditions, it's the opposite. It's cannot train, and just moving in space is exhausting. What's a strategy, action plan example that one can use so you don't feel like a failure, but you are still enjoying movement?
Right. That's a really great question. I think that's hard because the narrative that we put on exercise most commonly is focused on um, using it to have some sort of physical output. So the first point of that question was maybe being an athlete in the past or using it to train, using our bodies to train physically for some sort of output, such as a sport. And then now the narrative has changed and you're using exercise um, for a medical reason, but how do we enjoy it when we have all these other narratives in our head? I think that can be quite difficult. And I think that a specific or actionable tool would be to try and find something that you truly enjoy doing. I know that I said that several times, but it could be quite simple. Or perhaps choosing an exercise that you used to do, but changing the setting that you're engaging in that particular activity. So, um, for example, if you used to be a competitive volleyball athlete, um, maybe you don't engage in the competitive league anymore. You do it just for fun, which is much below your skill level, but you're still participating in something that you're used to and you're good at. And then if we take that further, and maybe there's now a physical health element that prevents you from doing something that you used to do. Maybe you have a specific program that you have to do from a kinesiologist, for stroke rehabilitation, for example. Is there a way you can do it outside in the sun instead of in the clinic, or with a friend or family member once a week so that it's a little bit more enjoyable? I think there are obviously even barriers in the way that we think about exercise, not just barriers within our time throughout the day, but thinking about how we can shift that perspective and maybe even just keep the same routine that you're doing. I hope that that answers your question a little bit, or at least it helps you think about what you mentioned. And I know it's hard because exercise is often not something that we talk about enjoying. So I think it is quite a new narrative to think about.
Amazing. I think that kind of goes into answering a bit of this question, but I'll ask it just in case there's anything else to add. But someone was sharing about their mother, and they are a stroke patient and complain of dizziness, resist resists to be active, and doing more passive exercise with physiotherapy. Any suggestions from you for recovering her back to exercise?
Okay, thank you for sharing. I'm just going to read this over. Sometimes it helps me to hear and to read. Um, okay, great. Well, I'm glad that she's working with a physiotherapist. That's a really great place to start. Um, Again, coming back to how exercise can look different for everyone. So potentially my suggestions to having her recovering back to exercise is that she'll be recovering back to something that, or perhaps maybe she's not going back to something, it's that she is finding new ways to engage in exercise. So if she's doing physiotherapy and there's some active and passive exercises, perhaps it's finding ways to enjoy those exercises a little bit more. Again, coming back to that example of doing it outdoors, and maybe speaking to the physio about what long-term realistic goals actually are, and how maybe she can move a little bit more just to simply enjoy it outside of the physio clinic. Particularly if there's some dizziness, then sometimes or oftentimes it's best to engage in exercise with someone. So maybe that's an opportunity for the two of you to engage in something together, whether that's a walk or doing activities with her. But I would say that the conversation should start with the physio about maybe what are the long-term goals for what exercise can look like for her.
Amazing. Okay. Moving on to what exercise will help my shoulders that click with a little soreness when I raise my arms. Of course, I'm reading the question.
Right. I can see that there. This is a great question for a physiotherapist. I do have a background as a kinesiologist. I would have to see the way that you move, ask you so many more questions about maybe any previous injuries or which range of motion you're getting that shoulder clicking. I'm doing it here just to give you an example, but there's a lot of different reasons why we can have those sort of clicks or pops when we move. On a sort of basic level with the shoulders, a lot of times it can be as simple as a lot of tightness in the upper body. So those stretches that we just did for the chest and for the back of the shoulders, maybe you noticed that actually it was maybe even hard to get into some of those positions we were just doing. Or sometimes it can be a bigger issue, or a bigger problem to solve with the shoulders of why there's that clicking. You said a little soreness. I'm not sure how much soreness again, or if it's like sharp pain. Sometimes clicking is normal. So I would start with a physio. I have too many questions to follow up to try and figure out why the shoulders might be clicking, but a physio would be a better place to ask that question. They're the experts on the clicking.
Okay. Now we have another question asking how to register for the UVS exercise program as mentioned in the presentation.
Okay. I mentioned two programs. So I mentioned the BC Brain Wellness Program, which Diana could maybe speak to on how to sign up for that. The other program that I mentioned was my own research, so Mind in Motion, which runs at UBC for students experiencing depression. The program is currently closed for the school year. The main academic terms just wrapped up. But you can, in general, if you are a student at UBC, reach out to counseling services and meet with a wellness advisor. And from there, they would be able to match you with the best treatment option, which could be an exercise opportunity. It could be Mind in Motion, the program that I spoke about, if it's in September or into the next school year, or any other treatment alternatives that are best for you if you are a student on campus.
Cool. And yeah, just for those that are interested in registering with BC Wellness, we have that did start on Monday for registering for the summer term. There may be some spots left, but it can get a little competitive there with getting into those classes. But do check on our website with the classes tab, and from there we have a step-by-step explanation of what you need to do to get registered in a class. And that can be exercise, but we also have creative classes as well if you want to get involved in that way, but would recommend there. Um, and now I'll ask another question where someone is asking about self-compassion and what that looks like or entails. Any examples or thoughts on a compassion perspective? Because you brought that up a bit in the presentation.
Mhm. Yeah, this is hard. Self-compassion is definitely hard, especially when there are some barriers or, again, changing physical capabilities. It's hard to remain compassionate. I think one of the things that I love about exercise for mental health is that thoughts come up while we're exercising, of course. We're never in this completely zen state, and so while we're exercising, maybe we can recognize the thoughts that come up and um, meet them then and there with compassion. So, for example, if you are engaging in exercise and something comes up of, maybe frustration of like, this isn't, why can't my body do what it used to do, or why isn't my body doing this? I don't look like the person leading the exercise session. Maybe then it's like, oh well, that's not where I'm at today. And it could be as simple as that. It could be also just recognizing like, yeah, I feel frustrated. We're just going to keep going anyways and see how I feel afterwards. I think self-compassion is really hard, and it's much easier to say be compassionate than it is to actually be compassionate with ourselves. Um, but I think my main tips or tools to incorporate more compassion is just to listen to the things that you're saying to yourself while engaging in exercise or before engaging in exercise. To start with small things like a 5-minute walk or sitting up and sitting down from the couch. That also counts if we can do that a few times. Um, and then being compassionate even by just saying, today I'm going to walk instead of doing the gym session that I hate. I saw an example there. Or I'm going to exercise in nature instead of going to the gym because I hate that environment. That also counts as compassion towards ourselves. um, I hope that answered that question. It's hard. I can definitely empathize with that. It is hard to be compassionate towards ourselves. It's a learning process.
Oh, that was a wonderful answer to that question. And I believe that is the last question we have. We're past 1 o'clock here. So this is the presentation, everyone. Thank you so much, Cassandra, for sharing your expertise with us today and doing a little movement break as well to get us engaged there. And thank you all for joining us. I really hope you are able to learn something new today, maybe implement some more physical activity in your life. And we hope to see you next month for our event as we have these monthly events. And if there are still any lingering questions, Cassandra will stay a little bit over time. But yeah, we are wrapping up here. So thank you so much, everyone. Have a wonderful rest of your day.